And then another theme is copper and angiogenesis. If you guys want to stop and take a break, or if you...
No.
Copper increases proliferation and migration of endothelial cells. And it's a key pro-angiogenic compound. The key pro-angiogenic compounds require copper for their synthesis and activation. And they include hypoxia-inducible factor, vascular endothelial growth factor, fibroblastic growth factor, tumor necrosis factor, alpha, and interleukin. And we all need copper. But it's interesting, because about 5 or more years ago, there was a analysis of all-cause morbidity and mortality in about, I don't have the study in front of you. I want to say it was a substantial number of people, like 5,000 people, where they had serum, they held it, and then they checked it again. And there was like a 30% increase in all-cause morbidity and mortality when copper and zinc were both in a normal range, but copper was higher than zinc. So if you think about it, and then you start looking at copper levels in people with cancer, they're often sky high, and those people often have significant disease progression. So angiogenesis is the development of new network of blood vessels which can support tumor growth and invasion. And again, it's stimulated by these hypoxia and these other growth factors. And without angiogenesis, the tumors would remain small, and actually they wouldn't be doing much. You could live a long life with them in your body. Now, cancer patients have increased serum levels of copper or a high copper-zinc ratio compared to healthy controls. And the serum copper correlates with tumor burden, advanced disease, and poor survival, which I alluded to. And the levels rise during active disease and fall to normal levels in remission. Clinical trials of copper chelation are ongoing, and they do suggest benefit. But like everything else in oncology, they don't work in a vacuum. And these are factors that can contribute to elevations in copper: plumbing, unfiltered tap water, copper cookware, swimming pool fungicides, medications. And this is one that really is, the oral contraceptives can be a big issue, and other sorts of hormonal manipulation, tamoxifen even. And no one understands whether, what if we gave people the tamoxifen but paid attention to the subgroup who had a rise in copper and addressed it with the no one's even, think about it. But I just had a lady in her 40s with metastatic colon cancer. And she had the initial tumor, it was resected. Unfortunately, there was a long delay in early first diagnosis, but she was disease-free at time of resection, and then she was followed for 3 years, and then ultimately the levels went up and they found this tumor in her peritoneum. And just as part of, and she was coming to me because she's working with a group I will refer to, the Center for Natural Healing, as part of her comprehensive program that includes herbal things, but full bore chemo and ultimately surgery, etc. But her copper level was sky high, and she was on birth control pills. Was that permissive to as an isolated factor to the progression or metastases? I don't really know. I mean, you can't draw a conclusion from one case. But anyhow, I thought that was very interesting. Zinc deficiency, cadmium toxicity, which is more prevalent than we think. All the old smokers and many other people who are inhaling from tailpipes. Within our environment, there's a lot of cadmium, and so it can have an adverse effect. Estrogen dominance, and then chronic inflammation. And these are just some foods that have excess copper. So if one's copper levels were high, maybe it'd be good not to have so much of these things. You'd have to, forego the oyster bull roast. And you can try to chelate the copper. Molybdenum is a trace mineral which we all need, and it can be effective. There's a special compound called tetrathiomolybdate that's being studied actively. But everything has side effects, and this, of course, could impair wound healing. In a subgroup of people could cause gout, can be associated with iron overload, etc. So you have to be careful when you're doing these manipulations. Zinc is useful, but in high doses can cause nausea, and importantly, can interfere with certain antibiotics. And then these are foods and supplements that might be useful. Vascular endothelial growth factor inhibitors, an herb, a Chinese herb called skullcap, all kinds of berries, more colorful the better. Boswellia, which is frankincense. Curcumin, ellagic acid, comes from raspberries, among other things. Fish oils, green tea. Grapeseed extracts, milk thistle, resveratrol, selenium, and genistein. And these are inhibitors of another group of growth factors. Reducing insulin alone inhibits endothelial growth factor. Reduction of excess growth hormone. Green tea, and so all these anti-aging, not all, but some anti-aging groups are giving people growth hormone. And I don't think that that's safe or healthy in the long run. And I think it's unwise. And I've seen a couple patients on those programs who in fact developed cancer. That doesn't mean they weren't going to. It just is not prudent, I think. Green tea extract, grapeseed extract, the licorice, quercetin. Apples are a good source, but you can't get enough from food. You have to use kind of pharmacological doses of nutrients. Resveratrol, and I think pycnogenol and vitamin D3. And then platelet-derived growth factor inhibitors include apigenin, ellagic acid, green tea, ginkgo biloba, and resveratrol. This is an example of a copper-lowering protocol, but frankly, it would have to really be a pretty sick patient. A lot of times I'll just encourage people to avoid foods high in copper, particularly avoid supplements with copper, and supplement zinc if zinc is low. And this is the last one I'll do, is vitamin D in cancer. Vitamin D induces differentiation, it inhibits cell cycle progression, it promotes apoptosis, and it inhibits invasion, angiogenesis, metastases. And you know what the Institute of Medicine said for the general population may be germane. I mean, it may be totally appropriate. Although I have to say that I just the other day was speaking to a person who is a sort of a vitamin D researcher, and he felt that he understood why they had to take a conservative approach, but he was taking a lot more vitamin D than they were saying. He was taking 4,000 units a day, and he measures it and looks for a certain goal. But having said that, I think they're looking for the greatest safety for the general population, and I have to respect that. So vitamin D inhibits estradiol synthesis and signaling, so it decreases expression of aromatase, which causes you to make more estrogen, and it downregulates the estrogen receptor alpha, which is the one more active, at least in the breast cancer model, but may be active in other cancers like lung. Estrogen's a growth factor in general, and so it's not only, its manipulation is not only germane to breast cancer and other female endocrine cancers. It has anti-inflammatory properties, and it plays a role in blood sugar regulation and improves insulin sensitivity. Let's see, this has to do with breast cancer, and it was a prospective study, 512 patients with early disease, 11.6-year follow-up. Vitamin D deficiency was associated with an increased risk of recurrence and death. Same with colon cancer and prostate cancer. Does that mean you take I think you take a amount that creates an adequate blood level. And so your target range, I think, is 60 to 80 nanograms per deciliter. The conventional thinking is anything over 35 is okay. It may be true for most people. And the dose range to achieve this goal is 2,000 to 10,000 units per day, or going to the Caribbean quite often.